So my name is Veronica Reyes. My pronouns are she, her, ea, and I am the Consent and Healthy Relationship Scholar. So today I'm going to be talking about sex education as used as a preventative measure for sexual violence. All right, and a little bit about me. I'm from Modesto, California. I'm also a first generation student that attends San Joaquin Delta College in Stockton. I'm currently majoring in sociology with an emphasis on public health. And this year I'm going to be in the transferring process. And my goal, my overall goal is to help those who face adversity and make safe spaces where I can using tools I've learned through research and outreach in the public health field. So I am going to preface a content warning. This presentation will go over sexual violence, and I've provided some resources below in case you or a loved one needs help or looking for resources as well. And this is going to be a little bit more in depth with my topic. So the topic I've been researching is basically the rate of exposure of consent education. Using sex education as a tool of prevention for sexual violence and assault in specifically Stanislaus County. By doing research in this area, I have found that there is a huge disparity when it comes to the topic of consent. And so this slide is going to go over terms that I might go over during this presentation. And I just wanted to have it defined for everybody to make it more inclusive. So consent is an agreement between participants to engage in sexual activity and non-sexual activity. Consent should be clearly and freely communicated. A verbal and affirmative expression of consent can help both you and your partner to understand and respect each other's boundaries. Sexual violence, a term that refers to crimes like sexual assault, rape, and sexual abuse. And these are non-consensual acts. Also domestic abuse, also called domestic violence or intimate partner violence, can be defined as a pattern of behavior in any relationship that is used to gain or maintain power or control over an intimate partner. Abuse can be physical, sexual, emotional, economic, or psychological actions or threats of actions that influence another person. Steps to consent. So I put these steps together because a lot of my respondents responded by saying that they didn't have like a physicality or like making consent a real situation for them. So I put these steps together. So I also put in situational talking points as well. So to give an example, so I'm going to go over the steps. The first one is ask. So consent should always start with the discussion between parties involved. And this is a situation where you can use this phrase. Would you like to try insert action tonight? And also I inserted this next phrase to start teaching consent to younger children, or it can introduce a conversation. So is it okay if I can give you a hug? So that one's like an easier way to introduce the topic of consent, especially in children when they're maybe going to see relatives or giving friends a hug. I think it gives them the option of saying yes or no, and also gives them body autonomy over themselves. And it's a great way to discover that situation. It also gives them the power to say that they have the power to choose themselves. So next is listen. So hear out the other person for yes or no after asking. Here's another phrase. No, I don't think I feel comfortable doing that. Yes, I've been thinking about it and I feel like it's a good idea. So this is very important when it comes to consent because people do come to their conclusions And it could be based on traumatizing events. Maybe they don't feel comfortable, or they just don't want to do said action. So it goes into the idea of respect as well. So do not try to push them to say yes. So no always means no. Respect reasonings for not moving forward with an action. This is also about respecting people's boundaries. So when somebody says no, it really does mean no. Pushing people often happens, and that is not a fully consent action as well. So you could say, thank you for letting me know how you feel. I want to ensure you feel comfortable and safe. And this reiterates the idea that both parties respect each other's boundaries. And I think that's very important. And so for the literature review, on the topic of consent, I discovered interesting findings in literature and reviews. So I'm going to go over the first topic, the bill mandates in California for comprehensive sex education. So there is a law in California called AB 329, and mandates every child to be taught comprehensive sex education curricula. That states that it should be taught by someone who can give medically accurate information up to standards with the state. And this was enacted, I believe, in 2016. And this is showing how community health educators or community outreach programs should be going to the classroom to teach sex education as trained professionals. So also in the literature, there was also suggestions for prevention methods to support people who suffer from sexual violence. In the research article, one suggested ensure youth know about available resources and supports for relationship abuse and sexual violence. Basically like saying how they should have more readily available resources when talking about the subject of consent. And also facilitate connections between victims, advocates, and prevention and intervention. This recommendation will allow people to feel more comfortable with coming forward. It creates a more open environment as well to report such incidents as sexual violence and abuse. And also, I did find that Stanislaus County has a health assessment done every few years. And this was published in 2020. And it was done from the years 2008 to 2017. So they go over a comprehensive review about everything about public health, from doctors to crime rates to education rates, and put out a review about every few years. And so this is the latest data that I could get for public health in this area. A thing that stood out most to me in this data was the overall crime rate. In California, it has decreased by 12%, but something that really stood out was that even though there was a decrease in California, there was an increase of violence in Stanislaus County region by 5.5%. So it increased during that time. And its assault has increased as well. Rape cases stayed consistent with the crime from 2008 to 2017, but I also would like to acknowledge that not all rape cases are reported due to stigma and taboo. So it might be, the number might be a little bit higher. So I would like to acknowledge that as well. And so I'm going to go through the data. So the research method for this topic was done through surveys. The surveys were distributed through social media and links. So I shared the links through my social media, Central Valley Health Scholars, and to people who I know lived in the Stanislaus County region. Participants were anonymous and only identified through gender, age, and schooling experience. I chose to focus on young adults 18 to 30 years old to recall the experience with the subject in their previous schooling. Below are the charts, are the demographic ranges. So the next slide. So here's some of the demographics. I do have age, so the most respondents for age was 26 to 30-year-olds at 75%. Next was 18 to 21-year-olds at 14.3%. And then 22 to 25-year-olds were the lowest at 10.7. Females were also more inclined to talk about their experience at 71.4%, and males 21.4%, and then I believe non-binary and prefer not to say were at 3%. So education level as well, there was a tie between some college and bachelor's degree in this area as well. And also high school was at 10.7. And so the topic of discussion, I did ask people to define the word consent, and I put together a word cloud. And so what you see here is the keywords, where if you see the biggest font, that's the most keywords used. So you see parties, agreements, explained, clear, something, yes, and consent. So those were the most used keywords when defining consent out of all the participants. And then here, I asked the question of how they learned about the topic of consent and where did they get their resources from. It was really interesting to find that most of the people who wanted to learn about consent were not reaching out to people in the community or not taught through people in the community. It was often online resources when used to get educated on this content of consent. So it was at 46.4%. With this not being a mandated discussion through the state in the education system, it does run a risk of misinformation being learned and used in the real world. This can also lead to dangerous situations because one can assume one thing and another one could assume another situational, and depending on the source as well. So if this is not a mandated topic through the state, like reproductive and pregnancy and all those other STIs and STD education, the topic of consent is often left out. So people often have to research themselves or try to find places. So this also leads to a big gray area about learning about consent as well. And I wanted to put some respondent comments. So I'm only going to identify them through the age group that they were a part of and their gender as well. So these are most the comments that I thought that stood out to me. So this one's going to be from a female, 26 to 30 years old. So an open discussion in the school community, moving away from the idea that sex education is a taboo subject, educating students as well as parents and family. So I often found, like, even getting the survey out, a lot of people were scared to take the survey because it was still a taboo subject. And I think how this person brought up the educating students as well as parents and families could be a great way. So say if these kids are talking about sex education in school, they should take home pamphlets to educate their families as well and have that conversation start to be open, so then families can talk to each other and see how it can make the discussion a little bit more comfortable in the family environment. And also female, 26 to 30, having a sex education readily available at all times, encourage students to ask questions and being taught about consent and how you can stop sex at any time. For teens to know they have a choice or they have a voice and it matters. This also reiterates the idea of starting to learn consent at earlier ages, because it's often so let out, often like glazed over. People just forget about teaching people that they could stop at any time. When even if you say yes, you still have the option to say no or to stop. So that's also a great point that this respondent has made. And also male from 26 to 30 years old. It should be taught at a much younger age and be inclusive to all sexualities, and there should be a lot more time spent throughout the school year. So I also found many of the other respondents found that they did not feel comfortable because it was not sexually inclusive to all genders and sexualities. So that also closed off from them asking certain questions, or they felt embarrassed. So I do believe that that is a disparity as well in sex education. So these are like the outreach and the next steps. So outreach was done in Stanislaus County. I called and emailed about 5 organizations that I knew and researched. I thought they taught consent in the schools. I found out that it was not a mandated subject. One specifically told me that no program is dedicated to consent, and teaching about people's anatomy was more important. And then I also found out that in the city, one of the surrounding cities would rather take a fine than bringing in a community health educator to talk about other subjects surrounding sexual education as well. And that creates a problem because it is basically not making a comfortable environment, or it's basically ripping away the opportunity from the youth to learn about resources and medically accurate medical information. So I'm going to make suggestions. Some suggestions that I have is bringing a separate organization to teach about this topic. And it also creates an open discussion because they're not seeing this person basically day to day. So the anonymity of this can also make people more inclined to ask questions. Also partnering up with an organization or county to create a comprehensive sex education curriculum that mandates the topic of consent to be taught in the classrooms. And last but not least, having a number of resources and websites posted in the classroom or other areas such as bathrooms, or having little cards can also help and make it more available and accessible to people who want these or are looking for resources. And that would be a great thing, especially if they can put like a card in their wallet. So in conclusion, I found that sex education was lacking in certain areas. It often let out the topic of consent, the foundation of sex education. This showed a health disparity in the county. Also, education could potentially help reduce the number of crimes by using education as a tool. It could help the rates of assault and rape potentially decrease as well. So I recommend using sex education to be taught at younger ages and including consent, what red flags are in safe environments and what those look like, along with giving information that is also readily available. Outreach also needs to expand via the internet and make sources where it caters specifically towards the population of the Central Valley, regardless of gender, age, and sexuality. This can foster by having an accurate source. This can lead to a better conversation and also can lead to a decrease in these sexual violence in the Stanislaus County region. And also by breaking down this barrier on this taboo subject, it could potentially save lives. And so here are my references, and I'll be taking questions.